Hi everyone, my name's Emily Bach, and today I'll be presenting my elevator speech on the role of the NP. What is a nurse practitioner? A nurse practitioner is an advanced practice registered nurse, meaning that they're a registered nurse that has advanced training. They have a master's degree or higher education. They take a national certification exam in their specialty, and then they go on to get their state license. The state's Board of Nursing regulates their scope of practice, but typical responsibilities include evaluating, diagnosing, prescribing, providing treatment, coordinating care, educating, promoting patients' health, case management, and providing counseling to different patients. Continuing on about what is a nurse practitioner. Nurse practitioners, depending on the Board of Nursing in their state, they can have either full practice authority or they can have partial practice authority where they have supervision by a physician. Either like an MD or a DO. They can specialize in different areas, including primary care, women's health, pediatrics, family medicine, and then they can do like acute care, critical care. And then there's further specialties like dermatology, neonatal, oncology, palliative care, emergency medicine, psychiatric, and many other specialties. Typical practice settings include hospitals, medical offices, community clinics, schools, birthing centers, home care, as well as like prisons and really any healthcare setting. How does a nurse practitioner differ from a physician assistant? There are many differences between a PA and an NP. So PAs are healthcare providers who practice medicine under physician supervision. PAs, their education is based off of the medical model, while NPs, their education is based off the nursing model. PAs are more generalists. They receive generalized education and go through all different types of patient populations and specialties, while NPs are more specific to a certain patient population, such as like women's health or pediatrics. PAs actually never practice independently, while NPs do frequently, depending on which state they reside in or they're licensed in. PAs actually need 2,000 hours of clinical training, while NPs only need 600 hours of clinical hours to obtain their degree. So they have very similar duties and responsibilities. However, PAs have more of like a surgical experience, while NPs are more NPs go into like maternal and neonatal rather than PAs do, and very few NPs work in surgical specialties. How does a nurse practitioner differ from a physician? So the definition of a doctor or physician is a provider of medical care in the form of medicine and or surgery. So the type of care differs between a doctor and an NP because doctors' patients typically have more complicated diagnoses. They require specialty care and more advanced treatment. So they're like not a higher acuity, but just more complicated than the patients that an NP would typically care for. NPs tend to focus on the impact of the diagnosis, while the doctors focus on the illness itself. There's also a major difference in an NP's education length compared to a doctor's. NPs on average will go to school for 6 to 8 years, while doctors are 11 to 15 years. And there's also a pretty big gap in the salary between an NP and a doctor. NPs make a little over $111,000, while doctors make $208,000 a year. Why don't you just become a physician? So nursing and nurse practitioners have a unique approach. They're much different from other fields in the healthcare field because they focus on patients as a whole rather than individual parts. NPs tend to focus on like a wellness approach and a healthcare maintenance and illness prevention, so it's just a different preference compared to how doctors' philosophy of their practice. I personally became a registered nurse first, and then I was towards the end of my junior year when I decided that I wanted to pursue like an advanced education and get my nurse practitioner. At that point, I had made it through like the worst parts of nursing school and I didn't want to change my major when I was going into my senior year. Had I thought of had I known that I wanted to be an advanced care provider, I would have gone to PA school straight out of well, I would have pursued that. But like I said, I had already gone through nursing school enough that it didn't feel worth it to switch to me. And then I never had any desire to be a doctor because the schooling was so long. So that's why I also pursued nursing rather than um like becoming a doctor or a physician. Here are my references. I hope you enjoyed my presentation. Thank you for watching.